A stroke, also known as a cerebrovascular accident, CVA, is a medical emergency that occurs when there is a disruption in the blood supply to the brain. This disruption can be due to two main mechanisms: ischemic stroke and hemorrhagic stroke. The pathophysiology of stroke differs between these two types, and the medications used in their management target specific aspects of the pathophysiology. Ischemic strokes account for the majority of stroke cases and occur when there is a blockage or obstruction in a blood vessel that supplies the brain. The main pathophysiological processes in ischemic stroke are as follows. Thrombosis, a common cause of ischemic stroke, involves the local formation of a blood clot or thrombus within a cerebral blood vessel. This clot typically develops in arteries that have been damaged by atherosclerosis, a condition characterized by the buildup of fatty deposits and plaque on the vessel walls. Over time, these plaques can rupture or fissure, exposing the underlying tissue and activating the body's clotting mechanism. Platelets and clotting factors rush to the site, leading to the formation of a thrombus that obstructs the blood vessel, reducing or completely blocking blood flow to downstream brain tissue. This ischemic event can result in stroke, depending on the vessel's size and the location of the clot. Embolism, on the other hand, involves the migration of a clot, embolus, from another part of the body, such as the heart or large arteries, to a cerebral artery where it becomes lodged. The embolus is often composed of platelets, fibrin, and other clotting components. A common source of emboli is the heart, particularly in individuals with conditions like atrial fibrillation, where the irregular heartbeat can lead to the formation of blood clots in the atria. When such clots break loose and travel through the bloodstream, they may eventually become trapped in a narrower cerebral artery, causing an obstruction and depriving a portion of the brain of oxygen and nutrients. Both thrombosis and embolism result in the formation of a clot within cerebral arteries, leading to the same devastating outcome: an ischemic stroke. The brain relies on a constant supply of oxygen and glucose to function, and even a brief interruption in this supply can cause brain cells to become damaged or die, resulting in neurological deficits. A hemorrhagic stroke, also known as a cerebrovascular accident, CVA, is a critical and potentially life-threatening medical event characterized by bleeding within or around the brain. Hemorrhagic strokes are less common than ischemic strokes, but are often more severe due to the damage caused by bleeding and the increase in intracranial pressure. Understanding the pathophysiology, risk factors, and treatment options for hemorrhagic stroke is crucial for effective management and prevention. Pathophysiology. Hemorrhagic strokes occur as a result of blood vessel rupture, leading to the leakage of blood into the brain, intracerebral hemorrhage, or the space surrounding the brain. Subarachnoid hemorrhage. The key pathophysiological processes include intracerebral hemorrhage. This type of hemorrhagic stroke involves bleeding directly into brain tissue. It usually results from the rupture of small blood vessels, often weakened by chronic conditions such as hypertension, high blood pressure, or cerebral amyloid angiopathy. The sudden accumulation of blood within the brain tissue damages surrounding neurons and creates increased pressure, causing further injury. Subarachnoid hemorrhage. Subarachnoid hemorrhages occur when there is bleeding into the subarachnoid space, a fluid-filled area surrounding the brain. This type of stroke is often caused by the rupture of an intracranial aneurysm or arteriovenous malformation, AVM. The presence of blood in the subarachnoid space can lead to increased intracranial pressure, cerebral vasospasm, narrowing of blood vessels, and damage to brain tissue. Let's elaborate on the various types of medications used in the treatment and prevention of strokes and their actions. Thrombolytics, e.g. tissue plasminogen activator or TPA. Action. Thrombolytics are used in the treatment of ischemic strokes. They work by dissolving blood clots, thrombi, that are obstructing blood vessels in the brain, restoring blood flow, and potentially preventing further damage to brain tissue. TPA is a clot-busting medication and is most effective when administered within a specific time window after the onset of stroke symptoms. Antiplatelet agents. Examples: aspirin, clopidogrel, dipyridamole, ticagrelor. Action. Antiplatelet medications prevent platelets from aggregating and forming clots in the blood vessels. They are used to reduce the risk of ischemic stroke and are often prescribed for patients with a history of stroke or certain cardiovascular conditions. Anticoagulants. Examples: warfarin, heparin, direct oral anticoagulants, DOACs like apixaban, rivaroxaban. Action: anticoagulants interfere with the blood's ability to clot. They are used to prevent or treat conditions that can lead to the formation of blood clots. Warfarin is often used in cases of atrial fibrillation, while DOACs are newer, more targeted anticoagulants with similar effects. Statins. Examples: atorvastatin, rosuvastatin, simvastatin. Action: statins are lipid-lowering medications that help reduce cholesterol levels in the blood. Elevated cholesterol levels are a risk factor for atherosclerosis, a condition that can lead to ischemic strokes. By lowering cholesterol, statins help reduce the risk of stroke. Antifibrinolytic agents, e.g. tranexamic acid. Action: these medications work by preventing the breakdown of blood clots. They are sometimes used to control bleeding, particularly in cases of subarachnoid hemorrhage, a type of hemorrhagic stroke. Blood pressure control medications. Examples: ACE inhibitors, e.g. lisinopril, beta blockers, e.g. metoprolol, calcium channel blockers, e.g. amlodipine. Action: hypertension, high blood pressure, is a major risk factor for both ischemic and hemorrhagic strokes. Blood pressure control medications help lower blood pressure, reducing the risk of stroke. Diuretics, e.g. hydrochlorothiazide. Action: diuretics increase urine production and reduce fluid volume in the body, leading to decreased blood pressure. They are often used in the management of high blood pressure, which is a risk factor for stroke. Neuroprotective medications, e.g. N-methyl-D-aspartate or NMDA antagonists. Action: these drugs are being studied for their potential to protect brain cells from damage in the event of a stroke. NMDA antagonists may reduce the extent of neurological injury during an acute stroke. The risk factors for stroke can be broadly categorized into modifiable and non-modifiable factors. Non-modifiable risk factors. Age. The risk of stroke increases with age. Stroke can occur at any age, but it is more common in older adults. Gender. Men are more likely to have strokes than women, but women are more likely to die from a stroke. Family history. A family history of stroke or certain genetic factors can increase an individual's stroke risk. Race and ethnicity. Some racial and ethnic groups, such as African Americans and Hispanic Americans, are at a higher risk of stroke. This may be due to a higher prevalence of risk factors in these populations. Prior stroke or transient ischemic attack, TIA. Having had a previous stroke or TIA significantly increases the risk of having another stroke. Modifiable risk factors. Hypertension. High blood pressure. High blood pressure is the most significant modifiable risk factor for stroke. It weakens blood vessels and can lead to atherosclerosis, making them more prone to rupture. Smoking. Smoking damages blood vessels, raises blood pressure, and increases the risk of blood clots. It is a major contributor to both ischemic and hemorrhagic strokes. Diabetes. People with diabetes have a higher risk of developing cardiovascular disease, which can lead to stroke. High cholesterol. High levels of low-density lipoprotein, LDL, cholesterol can contribute to atherosclerosis and increase the risk of ischemic stroke. Obesity. Being overweight or obese is associated with other risk factors, such as high blood pressure and diabetes, and can independently increase stroke risk. Physical inactivity. Lack of regular physical activity can lead to weight gain and contribute to other risk factors like high blood pressure. Atrial fibrillation, AFib. AFib is an irregular heart rhythm that can cause blood clots to form in the heart, which can then travel to the brain and cause an ischemic stroke. Diet. A diet high in saturated and trans fats, salt, and low in fruits and vegetables can contribute to risk factors like high blood pressure and high cholesterol. Excessive alcohol consumption. Drinking alcohol in excess can raise blood pressure and lead to other cardiovascular problems that increase the risk of stroke. Illicit drug use. The use of certain drugs, such as cocaine and amphetamines, can increase the risk of stroke due to their effects on blood vessels and blood pressure. Medication non-adherence. Failure to follow prescribed medication regimens for conditions like hypertension or atrial fibrillation can increase stroke risk. Migraine headaches. Some migraines, especially with aura, are associated with a higher risk of stroke. Nursing care of patients with stroke can be explained depending on the type of stroke which patient have suffered. For ischemic stroke patients, patient assessment. Conduct a thorough neurological assessment to determine the extent of deficits. Monitor vital signs regularly, paying particular attention to blood pressure control. Assess for signs of increased intracranial pressure, ICP, such as altered mental status, headache and vomiting. Medication management. Administer thrombolytics, if applicable, within the designated time window. Administer antiplatelet medications as prescribed, such as aspirin or clopidogrel. Ensure anticoagulants are administered in cases of atrial fibrillation or other indications. Neurological care. Position the patient to prevent complications, like pressure ulcers or contractures. Monitor for neurological changes or worsening symptoms, and report any findings promptly. Implement interventions to reduce the risk of deep vein thrombosis, DVT, and pulmonary embolism. Rehabilitation and mobility. Collaborate with physical and occupational therapists to develop a rehabilitation plan. Encourage early mobility and range of motion exercises to prevent muscle atrophy. Support activities of daily living, ADLs, as needed, focusing on independence. Education and support. Provide stroke education to patients and their families, including signs of recurrent stroke. Address psychosocial needs, offering emotional support and resources for coping. Educate on medication adherence and lifestyle modifications to reduce stroke risk. For hemorrhagic stroke patients, patient assessment. Assess and monitor vital signs frequently, with a focus on blood pressure control. Check for signs of increased intracranial pressure, ICP, such as altered mental status or changes in consciousness. Be alert to any signs of rebleeding, such as severe headache or neurological deterioration. Medication management. Administer medications to manage blood pressure within target ranges to prevent rebleeding. Administer antifibrinolytic agents if indicated to control bleeding. Avoid medications that may increase the risk of bleeding. Neurological care. Position the patient to prevent complications, such as pressure ulcers, and provide adequate head elevation. Monitor neurological status, assessing for changes in consciousness, motor deficits, or worsening symptoms. Implement interventions to reduce the risk of DVT and pulmonary embolism. Surgical and interventional care. Collaborate with the healthcare team in cases where surgical interventions are required, such as aneurysm clipping or AVM embolization. Provide postoperative care and closely monitor for complications following surgical procedures. Rehabilitation and mobility. Work with physical and occupational therapists to optimize rehabilitation plans based on the patient's condition. Promote early mobility and positioning to prevent complications, and promote recovery. Education and support. Offer emotional support to patients and their families during this critical period. Provide education on medication management, lifestyle changes, and dietary considerations, emphasizing the importance of reducing bleeding risk. Encourage ongoing communication with the healthcare team to address concerns and track recovery progress. Subscribe to our channel for more interesting nursing education videos. Full article on this topic is available at www.Nurseshere.com.